Yeah, hello. This is my name is Yemi. Uh, I'm I'm an RN registered nurse. I've been practicing in the state of Ohio since 1993. I just This is my channel. I hope you subscribe after you've watched the video to my channel. I'll be talking mainly on this channel on mental health nursing. Uh, I decided to do this because, we have a lot of people who are suffering from mental health and they don't have a lot of information out there, and also to, you know, educate the public and also people in nursing profession. Um, since I've been practicing, I've worked in various settings. I've actually worked in a state mental health hospital, and I have acquired a lot of experience in teaching. So this video is something like to just make like a little short videos of mental health topics that I actually teach in the classrooms. Oh, I hope you find it educational, and please comment, and you can ask any questions. I will try to answer them. And also, especially during this time of pandemic, a lot of people are, getting, depressed, losing their, you know, especially people who already have mental health uh, issues. Even people who don't have, like you and I, who seemingly are normal, being isolated is a lot of challenge for a lot of us. Not being locked down, though you have jobs, a lot of people work from home, but people are filled with anxiety about what is going to happen next. Are they going to be able to sustain their life the way things are going? Are they able to? And people who have small businesses, even though they receive, you know, support from the government, but those are loans that is, some of them they have to pay them back, and a lot of people are filled with anxiety about what is going on. Not to talk of people who already have mental health issues. Being stressed always bring out the worst and also exacerbate their condition. So today I just want to talk briefly about mental health nursing. I'll be talking about foundation of psychiatric mental health nursing. The World Health Organization actually described health as a state of physical, mental, and social well-being in the absence of disease or infirmity, meaning that being healthy, you have to be all around healthy, not just not having any headache or anything. You have to be mentally stable. And definition of mental health, we can say, is a constant change in our internal processes that helps us to harmonize with our society. For example, being ability to respect and care for ourselves and others or other living things, recognize or express emotions, sympathize with others, and being flexible, being able to be flexible or adapt or cope with adverse life events. And lastly, to function in a social and work environment, meaning that being mentally healthy means that even like during this COVID pandemic, you are able to adapt to the situation. Like, you are able to work from home, you are able to stay by yourself without being too anxious about what is going on, or thinking of death all the time, because you hear in the news many people are dying. Ability to cope with all these situations means that you are mentally okay, but that is not the case for some people, and some of these reasons are due to genetics or environment. Just some of them, when I start to talk about different mental health disorders, we talk about them. We are all made differently, even born in the same family. We have different genetics makeups, and also our environment sometimes determine how we react to situations in our lives. The mental illness is described as condition that disrupt all this thinking, that all this definition that I talked about earlier on, like disrupt the way we think, the way we feel, ability to relate to other people. You have disruption in your functioning in your daily life. That is what mental illness means. Then the prevalence, when they say prevalence, we are talking about how many people, just to help us appreciate mental health, that are living with one condition or the other of mental health. Because sometimes some people think mental illness is just, they always focus on people who have major chronic mental illness like schizophrenia or mania. A lot of people are living with anxiety, phobia, all those are under mental health, depression, and all that. So, National Institute of Mental Health in 2018 said 1 in 6 people are living with mental health. And also, World Health Organization says that 300 million people are affected by depression worldwide. So, mental health actually, it's just that people are not talking about it. It's really, a lot of people are suffering. And also, I want to talk about the criminalization of people with mental health. In United States, they have de-institutionalized patient with mental illness, meaning that we don't have to have them live in a certain environment. They are in the community since the inceptions of the new generation antipsychotics in the 70s. They deinstitutionalize patients with mental health. But what that leads to now is we don't have adequate funding for these patients, and also we have limited housing and also low community-based center cares for them. So a lot of them become homeless, and they are picked up for minor crimes, like walking intoxicated, refusing official business if they can't, afraid of the police officer can't answer their names, or they behave in a belligerent way in the public. They can be picked up, and some of them end up in jail. When they find out, though, that they have mental illness, they try to provide them with as much care they can achieve even in jail. But it's not the same as when they were institutionalized. They are deinstitutionalized also because, like I said, of the invention of the second generation antipsychotics, which helps patients now to have ability to be motivated, to take care of themselves, to develop new skills, learn new ways to do things, and are able to gainfully employed. So now the next thing I'm going to talk about is level of psychiatric nursing. You want to be a mental health nursing, you can be a practice at the level of registered nurse, which could be an associate 2-year degree program, or you can have a BSN, which is 4 years at a university, or you can practice as an advanced practice registered nurse. You have to be a registered nurse first. Then you can go further for your education and have a master level of education or doctorate. And what you can do as being an advanced practice nurse is you can actually, depends on the state where you work. You can work a little bit more independent, or you work with a physician or psychiatrist. You can actually provide psychotherapy. You can prescribe medications, and you can consult with patients. So the nursing skills that is required for mental health nursing, even though it might seem like you don't have many hands-on activity or tasks to perform with your patients, you have a lot to do. And you might be surprised that you will have hands-on too, because as these patients are progressing in their illnesses, a lot of them develop cardiovascular problems because of some of the side effects of the medication they take. So, but as nurses, some of the big nursing skills that you are supposed to have is to, be able to relate to your patient therapeutically, like, making sure that your patient is your patients, you focus your attention more on your patient needs and yourself. And we say therapeutic use of self. For example, providing presence, they said, meaning that you be with the patient. The patient feels like you are there, you are attentive to what they are saying. You use therapeutic communication, like asking questions in an open-ended question, not a yes and no answers questions. And like I said, remain focused on your assessment of your patient's needs. Mental, also another skills, not a mental health RN require is mental status examination. This is to help you to assess your patient's level of functioning and to be able to differentiate normal range of emotions from being or pathological state, like. So, and also in our observation in mental state examination, since we have to, sometimes need our patients' families observation, what they have noticed, since we have some of them outpatients, so we might need patients' families reports and things like that. And also the last skills that I will talk about that you need as a mental health nursing is how to manage your environment. We call it milieu management, meaning, even in medical surgical, when I discuss with my students, I remind them that even in med-surg, we are very conscious of noise level. Noise level is very important in managing our environment. We want our patient to be nursed in a calm environment that's, that they don't all of a sudden hear loud noise coming from somewhere. They are not sure what is this. That disrupts our patients' level of calm, and we don't want them to be agitated. If one patient becomes agitated, it can affect other patients. So I think that is all I'm going to talk about today. This is my first video. Ask me questions, post your questions, and I will try as much as possible to answer them. I have another channel that I can, if you have other questions that you want me to talk that is not about nursing, in general, I will answer that. And I'm Dr. Yemi RN. One of my channel is Mental Health Nursing, and the other one is just my name. Thank you for listening. See you next time.